Have you ever wondered why potassium plays such a pivotal role in our bodies? Well, let's dive in. Potassium is a key player in the grand symphony of our bodies. First up, it orchestrates the smooth functioning of our nerve and muscle cells. Imagine it as the conductor of this cellular orchestra, ensuring harmony and precision. Next, potassium takes the stage as the guardian of our heart rhythm. It ensures that our heartbeats are regular and well-timed, like the steady beat of a drum. Now, picture potassium as a master balancer, responsible for maintaining fluid balance in our bodies. It's like a skilled tightrope walker, carefully balancing the delicate scales of our internal environment. So you see, potassium is our body's maestro, conductor, guardian, and balancer. It's no wonder then that without it, our bodies would literally be out of sync. That's why maintaining the right potassium levels is crucial for our health. So, what's the ideal potassium range in our body, you might ask? Well, let's dive right into it. Potassium is a vital electrolyte, crucial for many bodily functions. It plays a key role in nerve and muscle cell functioning, heart rhythm, and fluid balance. The normal potassium range in the bloodstream is typically between 3.5 to 5 millimoles per liter, or mmol for short. This is the sweet spot where our bodies can operate at peak performance. It's a delicate balance, really. Too much or too little potassium can disrupt the harmony, leading to potential health problems. So, maintaining this balance is crucial. The body does an excellent job of regulating this level, but certain factors can tilt the scale. And when the scale tips, it can lead to conditions like hypokalemia or hyperkalemia, which are low and high potassium levels respectively. Any deviation from this range can lead to conditions like hypokalemia or hyperkalemia. So let's remember to keep our potassium levels in check. What causes our potassium levels to fluctuate? Well, a number of factors contribute to this, and we're about to dive into them. Let's start with hypokalemia, which is a fancy term for low potassium levels in your body. The most common cause of hypokalemia is a loss of potassium through the kidneys or digestive tract. This could be due to excessive urination or diarrhea, for instance. Certain medications can also lead to hypokalemia. Diuretics, for example, which are often prescribed for conditions like high blood pressure, increase the amount of water and salt your body expels. And unfortunately, potassium often gets shown the exit as well. On the flip side, there's hyperkalemia, which means your body's potassium levels are too high. Now, this is usually less about how much potassium you're consuming and more about how your body is processing it. The most common cause of hyperkalemia is kidney disease. Your kidneys are responsible for maintaining the right balance of potassium by removing the excess from your body. So if your kidneys aren't functioning properly, they might not be able to get rid of enough potassium, leading to higher levels in your body. While we're on the subject of health conditions, it's worth mentioning that certain disorders like Addison's disease, a type of adrenal insufficiency, can also lead to hyperkalemia. Certain medications, just like in the case of hypokalemia, can cause hyperkalemia. These include non-steroidal anti-inflammatory drugs, angiotensin-converting enzyme inhibitors, and potassium-sparing diuretics. Finally, let's not forget about diet. Consuming a diet high in potassium can contribute to hyperkalemia, especially in individuals with impaired kidney function. On the other hand, a diet low in potassium can contribute to hyperkalemia. So there you have it. From what you eat to the medication you take, and from your kidney health to other underlying conditions, there are a multitude of factors that can cause your potassium levels to swing from one extreme to another. These factors can cause an imbalance in your potassium levels, leading to potential health risks. Are there telltale signs that our potassium levels are off balance? The answer is yes. There are symptoms that may indicate whether you're dealing with hyperkalemia, too much potassium, or hyperkalemia, not enough of it. Let's start with hypokalemia. When your body is running low on potassium, it may send out a distress signal in the form of fatigue. You may feel tired, even if you've had a good night's sleep. The lack of potassium can affect your muscle cells, leading to weakness or even muscle cramps. In severe cases, you might experience paralysis that can affect your lungs and pose a serious health risk. You might also feel numbness or a tingling sensation in your limbs. Now let's talk about the heart. Potassium plays a crucial role in helping your heartbeat stay regular. So when there's not enough of it, you might experience palpitations or an irregular heartbeat, a condition known as arrhythmia. Hyperkalemia, on the other hand, often shows no symptoms until it's severe. However, when symptoms do appear, they can be similar to those of hyperkalemia. You might feel fatigue, numbness, or tingling. You might also experience muscle weakness or even paralysis. What sets hyperkalemia apart is how it affects the heart. Too much potassium can cause your heart to beat too slowly or even stop, a condition known as cardiac arrest. This makes hyperkalemia a potentially life-threatening condition. It's important to note that these symptoms can be quite subtle and may be easily overlooked or mistaken for signs of other health issues. This is why regular checkups are crucial for catching these conditions early. Remember, our bodies are complex systems that rely on balance. Too much or too little of any one element can throw that balance off, leading to a cascade of potential health issues. Potassium is no exception. Recognizing these symptoms early can help prevent serious complications. Stay aware, stay healthy, and keep your potassium levels in check. How do doctors bring our potassium levels back to normal? Well, treatment strategies for hypokalemia and hyperkalemia differ based on the severity of the condition, the underlying causes, and the patient's overall health. Let's dive right into it. If you're dealing with hypokalemia, your doctor might recommend dietary changes. Foods rich in potassium like bananas, oranges, and spinach can help boost your levels. For more severe cases, potassium supplements or intravenous potassium may be needed. On the other hand, if you're battling hyperkalemia, reducing potassium intake is crucial. This includes avoiding high potassium foods and certain medications known to increase potassium levels. For severe cases, medications to remove excess potassium from the body are used, or in extreme situations, dialysis may be required. Now, let's take a quick detour into the pathophysiology of these conditions, or in simpler terms, what's actually happening inside our bodies when potassium levels are out of whack. Potassium is a vital electrolyte that helps our nerves and muscles communicate. In hyperkalemia, low potassium levels disrupt this communication, leading to symptoms like muscle weakness and abnormal heart rhythms. In contrast, hyperkalemia, with its excess potassium, can cause the heart to beat irregularly or even stop. The key here is balance. Our bodies are like finely tuned machines, and just like a car needs the right amount of oil, our bodies need the right amount of potassium. Too little or too much, and things start to go haywire. In both hypokalemia and hyperkalemia, the goal of treatment is to restore this balance, to get the body's potassium levels back into that sweet spot where everything runs smoothly. Whether it's through dietary changes, medication, or more intensive treatments, managing potassium imbalances is all about restoring harmony to the body's systems and helping you feel your best. Understanding the treatment options can empower us to manage these conditions effectively. And remember, if you suspect you're dealing with a potassium imbalance, reach out to a healthcare professional. They're your best resource for getting back on track. What could happen if we ignore these conditions? Let's delve into the complications of untreated hypokalemia and hyperkalemia. Hypokalemia, if left untreated, can lead to severe muscle weakness or paralysis, which might affect the respiratory muscles, causing breathing difficulties. It could also result in potentially fatal abnormal heart rhythms. On the other hand, untreated hyperkalemia can be equally dangerous, causing muscle weakness, paralysis, and heart palpitations. In extreme cases, it may lead to cardiac arrest. But how do these conditions affect ECG readings? In hyperkalemia, the ECG may show a flattened T wave and presence of a U wave, while in hyperkalemia, the ECG may reveal peaked T waves and a widened QRS complex, indicative of the heart's struggle to maintain its rhythmic dance amidst the potassium chaos. So it's clear that ignoring these conditions is not an option. Remember, untreated potassium imbalances can have severe consequences, including life-threatening heart problems. Let's summarize what we've learned today. Potassium is a vital mineral, playing a critical role in our bodies, with a normal range between 3.5 to 5 millimoles per liter. When this balance tips, we encounter hypokalemia and hyperkalemia. Hypokalemia, a deficiency of potassium, can be caused by factors like certain medications and excessive sweating, while hyperkalemia, an excess of potassium, may result from kidney disease or drug side effects. The symptoms of both conditions can be subtle yet significant, ranging from muscle weakness to abnormal heart rhythms. Understanding these signs is crucial in seeking timely treatment. Treatments involve rebalancing potassium levels and addressing underlying causes. Complications can be severe, including life-threatening heart conditions visible on an ECG. So, keeping tabs on your potassium levels is a crucial part of maintaining overall health. Stay informed, stay healthy, and remember, maintaining your potassium balance is key to your well-being.